we're really excited and proud to bring an excellent star-studded panel of experts that can cut through all the misinformation and bring you exactly what you need to know to be able to make informed decisions about how to lead your life, how to go about with work, how to protect your loved ones, whether it's safe to go to the masjid, and how to deal with school, summer vacations, a whole host of questions that you've submitted to us and that you'll have the opportunity to submit online as well. This program tonight is brought to you by our partners at the National Muslim Task Force and sponsored by ISNA, the Islamic Society of North America, AMHP, American Muslim Health Professionals, and IMANA, the Islamic Medical Association of North America. These three organizations, along with the Fiqh Council of North America, have joined 40 other organizations, actually over 40 other organizations that are nonprofits nationally, to, in an organic way, pull together the National Muslim Task Force on COVID-19. This task force has done an incredible amount of work, whether it's policy and policy statements, social services, healthcare professionals, or those experts in fiqh and faith, to all come together to be able to be a trusted source of information in what otherwise can seem a really confusing landscape, a Tower of Babel. Whether you go to the AMHP website, the ISNA website, or the IMANA website at imana.org, you can navigate to information that's come out from the task force, the various statements that have come out before Ramadan and even after during the ending of Ramadan, from the healthcare professionals and from the religious experts and the nonprofit leaders on where we should be and what we should be worrying about when it comes to COVID-19. We're going to start out this evening with an overview by Dr. Uzma Syed on the current state of COVID-19. Let me tell you a little bit about Dr. Syed's background, and she'll be sharing her screen for this presentation. Dr. Uzma Syed is a New York-based board-certified infectious disease specialist with an antimicrobial stewardship committee position, as well as an infection prevention committee position, who is well published in pneumonia-related research. Dr. Syed has established and leads the COVID-19 task forces in several Long Island area hospitals. She's been featured as an expert on several media outlets on infectious disease. Dr. Syed cares passionately, in addition to her family life and her professional life, about education, and is the founder and CEO of a nonprofit called Align Us, which provides mentorship and career development for high school students. Her work has been covered by numerous media outlets, including the BBC, CBS, Fox, FiOS, Newsday, Syed Advance, and more. Dr. Syed, thank you so much for joining us. We'll let you share your screen and continue with your presentation.
Thank you so much. Assalamu alaikum, everyone. Hello. We've come a long way since the start of the pandemic, and I think today's topic is really relevant, as Nabil mentioned. There's a lot of information that's out there, and we really have to sort of process a lot of information, see what's relevant, and how can we move forward from it, because the misinformation that's being shared out there can really be detrimental. So just to give everyone a quick background on where we are globally, we know that we have, this is as of yesterday, today's numbers are even higher, but globally we know we have over 5 million cases. Worldwide, in the US, we have over 1.7 million cases. Death toll globally is over 359,000. You can see that. That's happening globally. And we also know that there's significant disease burden in the US as well. So we've seen that we've reached this week, actually, in fact, we reached a milestone in the US. And, we know that that was unfortunately not a good milestone, but we know that we've reached over 100,000 deaths. And that's really significant, from a pandemic perspective. And how do we move forward from here? Well, what we need to do is we really need to, really scale back and see what are our parameters that we're using for, mitigation practices, and how can we move forward, because it's, significant disease burden and lives that are being lost. So that being said, the amount of misinformation that's being shared out there is actually contributing to a lot of these numbers. And as we move forward and as we start to reopen, we need to make sure that we're sharing relevant information so that people know how to be safe and how we can prevent further loss of lives. As I mentioned before, New York has been the epicenter in the United States, and we've had significant disease burden here. We've had significant lives lost. We can see in the United States, as I mentioned, over 100,000, followed by the United Kingdom, followed by Italy, France, Spain, and Brazil. And if you look at the map of the United States, this has changed significantly since the start of the pandemic. And we can see, the areas that are dark and blue here are the regions that have had, significant number of cases and a lot of disease burden. And you can see that there's different shadings throughout the US. New York, as I mentioned before, was leading, with the epicenter being here, but we've really worked really hard with all of our mitigation practices and sheltering in place to really bring that number down, where we are now at the stage of reopening throughout, different parts of New York State. And we can see that, and it's been effective. All of our mitigation practices has been effective. Unfortunately, the rest of the country is not on the same par, because there's many states that have in fact reopened without in fact showing a steady decline in cases. So a lot of these places have in fact reopened prematurely, and we are seeing a significant increase in number of cases being reported daily. If we look at just a grid showing you the number of cases that we've had in the US from the start of the pandemic to where we are today, we can see really very few cases in March. And then, we can see slowly we climbed up to our peaks and our surges. And there are many states in the US that are still experiencing significant cases. And we see that if you take New York out of the equation, actually, although, it looks like our numbers, our curve has flattened, but if you take New York, which is the largest region of disease burden, that, that number really varies. The curve is not in fact flattened throughout the rest of the country. Looking at demographics, this graph here changes very frequently, and it's going to keep changing as we get more and more cases being reported. And really, once we're out of this pandemic, that we're going to have full-fledged data on this, but you can see that there's really significant disease burden, people being affected in ages 18 to 44, middle-aged, young adults and middle-aged people. And then you can see initially we thought that this was only going to be a disease of the elderly population, but we know now that although there's a very small representation, even in the pediatric population, that there's new findings. There's this multi-system inflammatory syndrome that people are presenting with. And so, there's always something new that we're learning about this virus. So where do we go from here? We have so much information that's been readily available to us at our fingertips, coming from every which angle, whether it be globally or even in the United States, and how to process all that information. So given that we're in this pandemic with a novel virus, it's hard to keep up with the information that's coming out there. But there is undue anxiety by the general population, because there's so much that's at stake here. Not only are we having lives being lost, but everybody's mental health is being affected. People's finances are being affected. It's a pandemic of just great scale. And so with the information that's being shared out there, it's really, really easy to get lost in the misinformation and sort of go down the wrong path. So what we really want to encourage people is to constantly share your source. Where's the information coming from? In this day and age, we have the luxury of having technology on our side, and unfortunately, sometimes it works to our disadvantage, because there's so much information that's readily shared that is not validated. It's very easy for somebody to just post any information on the internet, very easy for somebody to post anything on social media, and whoever is on the receiving end of that information will assume that it's accurate information because they see it in black and white, when in fact we know that that's not the case. So people need to really validate the source of where information coming from. And in general, we want people to also be responsible when it comes to sharing that information, because unless you know for a fact that that information is accurate, by being part of that transmission of the information, you're actually propagating more false information. And this can be detrimental. So what we're dealing with here is a pandemic of two sorts. We have the pandemic of the novel virus, and then we have the pandemic of the misinformation that's being shared just as rapidly, and it's really leading to dire consequences. So now, as we're opening up throughout the US, we really need to be diligent with this and make sure that the information, the sharing of false information, is really curtailed as quickly as possible. We need to make sure that whatever's out there on social media is being verified. I know there's many different social media platforms that are actually work really hard to do this, whether it's Twitter, or Facebook, or Instagram. There's a lot of different platforms that are really trying to verify certain accounts as being authentic and, where you can really go to for your information. We always recommend, obviously, that you rely on WHO, CDC, IDSA, DOH, all these places for your accurate information, but definitely challenge where the information is coming from so that you know that it's an accurate source and that you're not sharing misinformation. So why does this misinformation really develop? There's many different reasons for this, but there's a couple of important factors that contribute to this. One is that given that we're in this pandemic with really, a novel virus and so much uncertainty with significant lives lost and disease burden, and everyone's lives are essentially on hold and we don't know when we're going to get back to normal, there's, really significant anxiety that people have. And that anxiety, there's a lot of people that unfortunately cannot deal with that anxiety and cannot deal with the unknown. So in a way, some forms of coping for them is to really, not engage with the information that's in front of them and to sort of treat it as if it's false information and that, this pandemic, in fact, doesn't exist and I'm just going to go on with my life because, I can't handle the actual scenario that's in front of me that is, a dire one. So that's one reason. The other reason, unfortunately, is that sometimes people, unfortunately, want their 5 seconds of fame, and they will use this as an opportunity to propagate false information, and get their platform and get some notoriety. But unfortunately, as I mentioned before, there's some real serious dire consequences of this. Some things we can see that we have seen very clearly. There's a lot of anecdotal drugs that are out there, medications that have not yet been proven to be effective for COVID-19. And a lot of people have been sharing information about the medications. And unfortunately, the general public, which does not know too much detail about the scientific process, has been following this blindly. And we've seen, unfortunately, undue deaths from this, even people, unfortunately overdosing on things that are, formulations of chloroquine that are not safe, that are hazardous. So, there can be negative consequences from this. We know in the medical field that there's a significant amount of literature that's been coming out from the beginning of the pandemic that is at a pace that we can't even keep up with. And a lot of these journals have not, a lot of these articles have not even been peer reviewed. So we don't know yet how substantial, how significant they are. So it's hard to really take all that information in. So what we always encourage people is to take everything with a grain of salt and really just, take things one step at a time. In addition to the drugs, we have all these myths being shared about different ways to prevent the virus. People keep talking about steaming and hot water and alkaline foods. But we know there's not a lot of basis to this, just looking at virology and looking at how infection transmission occurs. So, all of these things lead to more and more, unfortunately, false information. And, the wrong information spreads leads to people's false sense of security, which then leads to more transmission of the virus. And these are things that really need to be addressed very aggressively. Another reason why this can propagate even further is unfortunately because of the constant changing of information which we see. And this is not unusual for a novel virus and a novel pandemic that we're in. Things are going to keep changing as we learn more and more about this virus. Well, unfortunately, the general population oftentimes feels uncomfortable with the information that's constantly changing, and some level of mistrust can develop. And especially so when you have differences of opinions between scientists and government leaders. So that creates another level of mistrust, which then can propagate further misinformation and conspiracy theories. So that's something that's really at the crux of all of this, that we need to find ways for all of us to sort of be on the same platform and on the same bandwidth, and to say and share the same vision, because this is what's leading to more and more misinformation and false information that's being shared. So as we enter into reopening of many states and in the summer months approaching, we really need to keep in mind that, the virus is very much with us still. It has not gone away, but we need to be very cautious with, our practices, because our practices today, our behavior is really what's going to control and really what's going to dictate what's going to happen in our country and what's going to happen globally. So really, we need to share accurate information. We need to make sure that we are all still practicing mitigation practices and that we're careful as we then slowly start to reopen, because we are still seeing active number of cases, many states with climbing number of cases. And at the end of the day, a life is too precious, and we reached, surpassed our 100,000 mark, which we thought was, something that was not a reality for us. And unfortunately, we can see that these numbers are going to continue to climb.
Dr. Syed, thank you so much. I think that was a great framing and review of where we're at now and some of the challenges that we have. I would like to, at this point, ask your opinion and the other panelists' opinions as well about an important question. But before I do that, let me go ahead and introduce to everybody online who the remainder of our panelists are. First, we have Dr. Syra Madad. Dr. Madad is an American pathogen preparedness expert. Dr. Madad is the Senior Director of the System-Wide Special Pathogens Program at New York City Health and Hospitals, where she oversees New York City's response to the coronavirus disease 2019 pandemic in the city's 11 public hospitals. We also have Dr. Nada Fadul. Dr. Fadul is an associate professor of medicine at the Division of Infectious Diseases at the University of Nebraska Medical Center. She is the medical director of UNMC's Special Care Unit. She completed her medical degree from the University of Khartoum in Sudan, and subsequently completed an internal medicine residency at the University of Illinois, a palliative care fellowship at MD Anderson Cancer Center, where she served as faculty for 5 years, and an ID, or infectious disease fellowship, at the University of Texas at Houston. She is published in peer-reviewed journals, authored and co-authored several abstracts and book chapters, and has presented her research at national and international meetings, mentoring several students and trainees along the way. She is a member of the Leadership Development Committee of the National HIV Medical Association and serves as an Infectious Disease Society of America advocacy liaison. We also have Dr. Abdul El-Sayed. Dr. Abdul Rahman Muhammad El-Sayed is an American politician, former public health professor, medical doctor, and civil servant. He was candidate for Michigan's 2018 Democratic gubernatorial primary election. In September 2018, Dr. El-Sayed founded Southpaw Michigan, a political action committee to help elect other progressive candidates in Michigan. He was executive director of the Detroit Health Department and health officer for the city of Detroit from 2015 to 2017, before he resigned to run for governor. He is also formerly an assistant Department of Epidemiology at Columbia. But currently, he's also a political contributor at CNN and the author of Healing Politics, A Doctor's Journey into the Heart of Our Political System. Welcome to all of you. Thank you all so much for joining us. I'm going to ask Dr. Madad, maybe if you don't mind starting out, what has been your experience about the role of misinformation now, and how is it affecting our current situation?
So first, thanks so much for having me. So excellent question. And unfortunately, as we know, misinformation is running rampant all over, not just the United States, but all over the world. And based on my own experience with various different infectious disease outbreaks, this is obviously not something new. We've actually experienced this in a number of different epidemics that we face not only as a nation, but around the world. So, I think the most recent example for me has been the measles outbreak that we had here in New York City, just a little over a year ago, where we closed out with over 600 cases. And what we found, and again, this is not something new, is that one of the single most important pillars of public health response is trust. And we want to make sure that people trust information that's coming out of all levels of government, whether it's the federal government, the state, the local. And in this current epidemic that we're facing with COVID-19, it's much different than what we faced previously. So, based on my experience, what I dealt with the measles, with Ebola, with Zika, they're all different issues. Each outbreak is very different, but what's unique and unfortunate about this particular epidemic is that we are seeing misinformation at the highest levels of government. And again, as I go back to that notion, trust is extremely important. And so we want to make sure that not only are people staying informed with the right information, going to the right sources, but they unfortunately should not listen to people that don't know what they're talking about. And this is where we want to make sure that science and medicine, has a front seat, and that those should be the leading voices, and that we're relying on tried and true measures that we've relied on for centuries when it comes to public health. In my particular role here in New York City in responding to COVID-19, I'm heavily involved with the containment and suppression phase. And so this is where we're looking at not only identifying those that are infected, but doing the contact tracing, and then offering the wraparound services for not those that need to be isolated, but also the quarantine individuals through isolation hotels and food and meals and things like that. But none of that can be possible without people knowing that they have trust in the people that are serving them, that we're providing them the accurate information in terms of why it's important to isolate, why it's important for you to quarantine yourself, for example, things like that. And this is something where we need the entire population to really be on the same page, because as we know, it just takes that one person to start new chains of transmission. And so, from my standpoint, this is something that unfortunately is plaguing society since the beginning of this epidemic. We're hopeful that people listen to people that, true voices, people that actually have the facts, know what they're talking about. No one is an expert in COVID-19. Obviously this is a relatively new virus, but we want to make sure we're relying on experts that have a background in this, and really, just staying informed.
Thank you, Dr. Madad. I appreciate that response. Dr. Fadul, I want to ask you the same question. What's been the role of misinformation from where you stand in your perspective? And I'm going to add an additional wrinkle. The misinformation is not only at the local or regional or national level, but we're seeing it potentially at the international level. Could you help us understand what your perspective is on misinformation at all those different levels?
Yes, thank you again for the invitation, and that's a really good question. So I'm a first-generation immigrant to the U.S., so I deal with both worlds, where I come from and where I live now, and I see, unfortunately, the same level of misinformation at both levels, but it's a little different twist when it's coming from international sources, because naturally in our culture, and this is pretty true for most of the Eastern cultures, we rely on communities to get the information. We rely on neighbors, on our parents, on our cousins and uncles. That's where we get most of our information growing up. And with COVID-19, we didn't really have that learning experience because it's a new disease. So we didn't grow up learning about COVID-19 and what to do with it and how to cope with it. So unfortunately, people had to kind of fill that gap with a lot of information relying on their previous knowledge about other diseases, which is not always applicable to this type of disease. So an example of that have been circulating recently is about using garlic, for example, for COVID-19. We know garlic is probably a good substance for some diseases, but how to take it and the doses to take it, and whether this truly works for this type of disease or not, it's not really applicable here because it has not been studied. It hasn't been proven to work, whether in the lab or the human body. I see a lot of misinformation about the virus itself, a lot of conspiracy theories about this is not really a virus, this is something that's created by some mysterious government. There's a lot of information that comes that's religiously tied to this being, whether it's being a sin or whether it's being punishment. So we really have to take the role of being socially responsible. This is not a work of one person. It's not the work only of the government or the work of only the medical system. Everyone in society has to take ownership of trying to prevent the spread of this type of misinformation. So like Dr. Syed said, don't propagate this. When you see something, be skeptical. If it doesn't really make a lot of sense, if you Google it and you don't see a credible source like the CDC or the WHO saying this type of information, you have to question it, and you can't really spread it out because you're actually going to hurt somebody by spreading this information, because somebody out there might not seek medical advice because they will think taking garlic will prevent them from getting sick and end up dying of this disease. So this is a very serious situation. It's very dangerous. You're probably going to end up hurting someone. So I would urge my colleagues, my friends, and my family members to be socially responsible, to practice the principles of Islam, of no hurt or no harm to others, because by spreading this type of information, you're actually doing harm. And remember, this is a disease that's changing every day. We're learning new information. So what was true a month ago is not necessarily true today. So always seek expert advice. You know, I get a lot of messages on WhatsApp asking me about this vitamin or that vitamin. And many of us in the medical field are happy to answer those questions and let people know whether they should do this or not, and not to hurt themselves. So seek help, seek advice, and please don't spread it to others because it could be potentially dangerous.
Thank you, Dr. Fadul. Dr. El-Sayed, the same question to you from your perspective, the role of misinformation, but if you could add a little bit more perspective on how misinformation can sometimes be spread even by those in positions of authority or political influence. Has that been a problem from your perspective in the current crisis?
I'll just be frank, to answer the question. Unfortunately, one of the chief spreaders of misinformation throughout this crisis has been somebody who should be more busy leading the crisis response. And that has just been the facts, whether it's the absurd, which includes the argument that injecting in disinfectant, which is a terrible idea and nobody should do, may help cure the virus, or the choice to at least say that one has taken a medication for which there is not substantive evidence for certainly treating and or reducing risk of COVID-19. So, yes, unfortunately, public officials have spread misinformation, and they've done this with the goal of politicizing this pandemic to create two sides to every story. And, when they recognize that when the public is busy having a debate about two sides, we're less focused on the fact that the response and what was necessary from a public perspective was failed. And here we are, unfortunately. The other point I'll make is that so much of the response to COVID-19 isn't about what I can do for my own health. A lot of the response is about what we can do for our collective health. And that's the hard part about public health, is that it requires collective action. It requires all of us buying into a plan. And whether it has been social distancing and the stay-at-home orders, or it has been something as simple as wearing a mask to protect people from virus that you may be shedding in small droplets in the air that you're breathing when out of your own home. These have all been politicized and been turned into broader emblems of a perspective on something. And the hard part about a pandemic is that you cannot protect yourself as well as the public has to protect our collective self. And when you undermine public support for public interventions, everybody gets hurt for it. And I actually think that has been the most dangerous form of misinformation. The purposeful politicization of public health interventions that we know are effective, to turn them into points of debate when, in fact, the only real debate had to be scientific, and the debate is resolved. We know that social distancing was important. We know that it continues to be important. We know that we may, in fact, need to go back to social distancing if, in fact, we see a second wave. But this has been so politicized now that that folks are asking, they're second guessing public health officials who are saying that this is, in fact, the right thing to do. Similarly with masks. And so, it's not just the absurd at-home remedies or, absurd arguments about who may or may not be susceptible to COVID-19 that we see floating around, whether it's, the garlic as Dr. Fadul talked about, or it's, somebody who'd said that, you steam your throat, you are less susceptible. It's not just those home remedies and the things that people do for themselves, but really it's the undermining of our collective impact and the kind of public health interventions that we're going to need to be able to continue to take this on and take it on, in fact, if we have a second wave.
Great, thank you. I'm going to switch to Dr. Uzma Syed. I'm going to use the full names because we have two similar last names. And the question I have for you, Dr. Syed, is really addressing and following up on what Dr. Abdul El-Sayed was just talking about. We see that there is a little bit of some confusing messages, mixed messages being sent from public. Well, if I take all the sources of information, there's public health authorities that I trust. There's also different levels of government, federal, CDC, state governments, and in some cases, county and local governments, which all are offering different perspectives. And all 50 states are at this point in some state of reopening. And sometimes that doesn't seem to jive exactly with what the CDC is saying. So one point of confusion for a lot of folks is, well, if I can get another tattoo in the state of Georgia where I am and go to the movie theater and businesses are opening up, do I really need to worry about the potential transmission and spread of coronavirus still?
That's a great question. And I think something that's very challenging for us in the US, and which shows clearly with the amount of cases that we have, is the fact that we essentially operate individually. All the states have a lot of autonomy and are able to govern themselves, essentially. The thing that makes this pandemic, even more challenging is the fact that, a lot of people have, if they haven't personally had contact, know somebody who's had COVID, who's had illness with it, who's needed to be hospitalized, whether it's a friend or a family member, they often don't see the reality of it. Just the numbers on the news, don't really have that impact for them the way that knowing somebody personally would. And that seems to be a rather big challenge with dealing with this pandemic as well. So, the other thing is that because we have such a long incubation period, we have a highly communicable virus with a rather long incubation period, people feel this false sense of security as well. They just go out and feel like everything is fine, everyone's out and about, and, they won't really see the consequences till much later. So I think, it's really important to look at states that have gone through it and see what the consequences of that were, and you really best prepare yourself, depending on what state you're in, for those patterns to keep happening, because we can see it throughout the US that there's so many states that are being affected and climbing cases, and we know that everybody essentially is susceptible to this. It's a novel virus that nobody's ever been exposed to before, and nobody has immunity. And it's really, it's not, it's affecting everybody. So this virus does not discriminate, and we know that clearly.
Thank you. I appreciate your response there. Dr. Madad, I have a question for you, and it relates to all of what we've been talking about. As more and more people get exposed to the virus, we've heard of herd immunity, and we have people that are getting tested for antibodies. So there's a lot of confusion about the concept of herd immunity, and people also are confused by whether if they've gotten tested for antibodies and it shows that they've been exposed to the coronavirus, the novel coronavirus previously, are they now immune, or do they have an immunity passport? We know there's some European countries that have even their strategy has been just to achieve herd immunity to some degree. Can you comment on these concepts of achieving protection through herd immunity or previous exposure? We've even heard of people that have had COVID parties to get exposed to the virus where they may otherwise not have.
So thanks for that question. It's certainly a very important one because it's something that's highly talked about in news over and over again. So two means of obviously achieving herd immunity: one through natural means of people naturally getting infected, and with that, if you look at the seroprevalence and the various studies happening around the United States, you can see that we still have very low numbers of overall immunity, if you will, to the virus. With New York City, with a little over 20%, and then a number of other states at various levels. And so we are nowhere near kind of that herd immunity level that we need to be to accomplish the goal. With this current virus, you have estimates of anywhere from at least 60 to 70% and then upward. The other form of trying to achieve herd immunity is through inoculation, so through obviously vaccination. And what we know about vaccination is, while we're working at a warp speed of trying to get a vaccine, at the end of the day, we need a safe and effective vaccine. And so it's very hard to put a timeline to that. And you've heard experts like, Dr. Anthony Fauci and many others talk a little bit about what the various phases are and what it'll take to obviously have a vaccine. But, there's a lot of loopholes we have to jump through to get even a vaccine, and then obviously to manufacture it and distribute it at a large scale, let alone a number of other various movements that may undermine even getting vaccinated, like, the anti-vax movement and things like that. Again, something that is not new, but we're already hearing about it without even having a vaccine available for coronavirus disease 19 yet. So those are the two means of obviously trying to get to that herd immunity level. The first, through natural means. You can't just let the virus run rampant in a population, because you're going to obviously have a lot more morbidity and mortality at the end of the day. And that's really not the goal. We want to try to save as many lives as possible. And so there needs to obviously be a rhyme and rhythm to it, a phased approach, if you will. And that's what's happening in a number of states. Here in the state of New York, for many of you that may still be, here in this current state, we still have a shelter-in-place order, depending on what location you're in. I'm in New York City, and so they're starting to plan to open up and have a phased approach. And so that's really the way to go, because at the end of the day, the virus is still out there, and as Dr. Uzma Syed mentioned, this is a highly transmissible virus. There's still a lot to be done. We're still very early on in this pandemic, and right now, unfortunately, we have very limited choices in terms of our next steps because of the mismanagement of the outbreak very early on and our slow response as a nation. Cases were running rampant, and now we need to get to a point where we have manageable case counts, where we're able to do, that everyone is talking about, identify, isolate, contact trace, and quarantine. And a number of states are starting to ramp up their contact tracing workforce, and some of them are using volunteers, others are repurposing health, state and local health officials to serve as contact tracers. Others are using the National Guard. Here in New York City, something that I'm part of, we are hiring a number of individuals to be contact tracers. The number of contact tracers will vary across the state depending on the population. We're onboarding thousands of people right now. Obviously, state of Texas is also doing something similar. You're hearing estimates of the United States needing at least over 100,000 contact tracers to be able to contain the virus. The goal of obviously what we're trying to achieve right now is not to have the virus go away, which would be wonderful, but we know that's not the case. But what we're trying to achieve is have it at manageable levels, trying to contain and suppress the virus, so that way we're buying ourselves more time for a better therapeutic and vaccine. So a lot of that is happening behind the scenes. When we talk about contact tracing, it's an extremely manual process. We're trying to automate portions of it, but again, it goes back to that trust, because you have somebody on the phone that's talking to an individual, telling them that they have COVID-19, or they've been exposed to somebody that has COVID-19, and trying to trace all their contacts. It's not perfect, but it's a tool that we've used in public health for many, many years for HIV, syphilis, TB, Ebola. Has worked. We're hopeful that it's going to work at the large scale that we're implementing it. In responding to a respiratory virus today, we're going against a number of different challenges because this is a respiratory virus in nature, because there's asymptomatic spread, because how fast it can spread. We're trying to work as fast as possible and offer the services. But that's really what we need to do to try to really safely open up the economy and go back to any form of new normal, if you will, until we're able to get to that vaccine or effective therapeutic.
Great, thank you. Dr. Fadul, online, Dr. Rabia J says that it upsets her when she sees the Muslim community or other religious communities suggest that the current crisis could be a punishment for wrong deeds or for sins. I'm not going to ask you to comment on the intentions of God in this situation, but a closely related question is that I've heard these, you've probably heard these things too, that there are conspiracies, that there are, forces at work, and that it's actually 5G that may cause COVID or increase susceptibility, and that there may be plans to inject microchips into people who are receiving vaccinations eventually for 5G. And all this was hashed out before as an excuse for that. From your perspective, is there any evidence of these conspiracy theories being true? I mean, I've got to admit, I'm being a little bit ironic here. When you hear them and you really get into it, they can be pretty convincing.
Well, thank you for that question. I mean, it's a very interesting question, but unfortunately it's very common, and we hear about it quite a bit nowadays. So there have been a lot of studies, actually scientific studies, that looked into whether COVID-19 could be manufactured or not. And there are certain characteristics of a virus that will tell you if this virus was actually made in a lab or whether it was a natural emergence of the virus from other species and other animals. And to this date, we're not aware of any study that could prove that COVID-19 could have actually been made in the lab, because we could not identify that type of characteristics in the virus that's circulating right now. What we know about the virus for sure is that it emerged from animals, probably bats, and then got transferred to human and adapted to the human host by certain mutations. But as I said, it cannot have been made in the lab because it would have told on itself. Unfortunately, these conspiracy theories are not new when it comes to viruses. Similar conspiracy theories were around when the HIV epidemic first started, and they continue to this date, that people, some places, believe that the HIV virus was made by a man and was given to get rid of certain populations, etc. So our job is that we really need to counter back to these conspiracy theories, because all they do at the end is that they impede progress. They impede scientific progress. They impede prevention progress. We've seen the case with anti-vaccine groups emerging and spreading a lot of misinformation about vaccination, which have led to emergence of outbreaks of diseases that should be eliminated around the world right now, such as measles, etc., that we should not really be dealing with these types of outbreaks in the 21st century. But unfortunately, because of the propaganda that happens with all these conspiracy theories, that leads to damage and dangerous behaviors from certain people to oppose the science, which is the way that it's the only way that we can actually combat these types of pandemics. So I hope that people cling to science and follow the science where it's going, rather than spread these types of conspiracy theories that are not founded in any type of scientific rationale.
Thank you, Dr. Fadul. Dr. El-Sayed, we've been talking a little bit about conspiracy theories, and we see online one of our attendees says that she's very frustrated as a professional trying to counter the narratives of sleekly produced conspiracy theories online videos and counter their effect in her own community, in her own religious community, in other communities as well. Some of these have even indicated that if a vaccine is eventually available here in the United States, that people won't have a choice of whether to be vaccinated or not. Can you comment on these well-produced videos, whether it's something like Plandemic, and some of the fears that people have that the vaccinations or the response to COVID-19 will somehow limit their civil liberties, their ability to choose?
Yeah, it's deeply troubling that no matter when or where, whenever there is a broad swath health intervention that is being considered, there are almost always conspiracy theories that pop up about, population control or poisoning or, the government and or corporations trying to trying to limit your civil liberties or force you to buy a product. I'll say this, that there is a lot of legitimate challenge with the pharmaceutical industry and some of the ways that they operate. But when it comes to what we're seeing in real time about this pandemic, there are also a small but very loud group of people who have a lot of money to make off of peddling conspiracy theories. That's why their videos are so slickly produced, because they will claim to have the real answer, and then you'll go to their website and they're trying to push, some supplement or some medication that they say can protect you instead of, the vaccines or the medications that evidence-based science recommend. And so, the approach that I would say to this is, why do you think that some individual, whether it's the Bakersfield boys or it's the individual in pandemic, why do you think that the vast majority of scientists disagree with this? And can you verify any of the claims on their own faiths, independent of the story that's told? Can you verify the individual claims in the video? A. B, what is it about the need to find some conspiracy that makes you more comfortable? Because oftentimes there is a fear that's driving the need to find something. What is it about that that makes you more comfortable or makes you feel like you have an answer? And what is it about the lack of control that we're so uncomfortable with? And then C, if you talk to the folks in your community, oftentimes what I'll say is like, look, you may not trust me by virtue of being the one who is disagreeing, or by virtue of what you think I'm close to, the quote unquote biomedical establishment. That's fine. But I'll also ask you, right, in our tradition, in our faith tradition, we have a responsibility to tie our camel. And if you know that there's a really infectious disease that could very well hurt you and your family, why is it that you might choose to do something that is dangerous and or forego a treatment or a vaccination, rather than just tying your camel and saying, look, I may or may not believe it, and we may or may not be able to convince you. But that shouldn't you at least try and tie your camel and protect you and your family to the degree that you can? And then the last point I'll make here is to say that we often make the mistake of trying to yell at people and assume that we're going to win them over by yelling at them. And oftentimes people who believe in conspiracy theories believe in them because they're afraid. And I've always found that when you yell at someone who's afraid, you don't actually win them over, you just make them more afraid. And so I think we have a real responsibility to step back and not engage in that emotional way and call people stupid or say that they're gullible or at all pique their emotional response, but rather to step back and say, look, I get that you're scared, I get that you're frustrated, and I get that this changed our entire lives. But let's ask ourselves, right, let's take our skepticism to this question and ask ourselves what's probably more plausible. What can we find proof for? What can we find a second opinion on? And let's actually interrogate the claims that people are making, and ask ourselves why it is that the community of scientists believes one thing, even if a couple of people with scientific credentials are differing entirely. And I think walking people through that while holding their hand and having an empathy for their fear, I think is probably the most powerful way to take this on. I always say that you can either win the future or you can win the argument. And it's a lot more powerful to win the future. And we've got to win the future because it really is a matter of saving and empowering people's lives.
Thank you, Dr. El-Sayed. I have a series of 3 or 4 questions that I'm going to throw out there. And for any of you on our panel, if you'd like to address them, just jump in. And if there are 2 people talking at the same time, that's okay. We will manage it. And the series of questions are, number 1, what about house pets? Can we give it to them? And can they spread it to us? Is there any concern that we should have about house pets? What's the evidence there? Question number 2 is, we see in some places, and this question was posed by Mansoor A. online, that there's a lot of patients that are getting new cases of COVID-19, but the death ratio is not necessarily rising. And in his particular case, he's talking about his country of Pakistan. Could it be the heat and the climate that's mitigating the effects of it? Question number 3, is there any evidence of any medications that are effective for treating COVID-19? And question number 4, hey, isn't this all just blown out of proportion? What about the flu? Don't thousands of people contract and many people die from the flu as well? Is this being exploited for political reasons to somehow confuse us about the impact of COVID-19 versus the flu? So I'm going to recap: pets, the impact of climate and heat, any medications, and what about the flu? Who would like to jump in?
Let me jump into the last two. So the heat is, there is some good evidence to suggest that viruses that are of the form of coronavirus last for a shorter time in hotter, humid weather. That being said, let's be clear, right? If the heat was going to address this, then we shouldn't see bad outbreaks in places like Florida or Texas or Georgia or Alabama, where it is hot. And so I think that one's pretty easy to address on its face. That being said, it could be something that reduces at some modicum transmission. And so that's a good thing. But the danger here is that because we rely on the heat, we stop doing all the things that have a really big impact, like social distancing, like wearing masks, and then see a gigantic second wave in the fall. The second question that I just want to touch on is, isn't this just like the flu? There are a lot of reasons why it's not. Flu has been around for a really long time, and even if we may not be fully immune to all versions of the flu, there is some overlapping immunity across flu viruses, which reduces the transmission, number one. Number two, coronavirus is far more infective than the flu, right? We use this number in epidemiology called the R-naught, which is the number of new cases per individual case. And the R-naught of the flu is about 1.4. The R-naught of coronavirus is right around 3. And I know that difference doesn't seem very big, but if you take 3 and you multiply it by itself 10 times, you're now talking about a number that's like 59,000. Whereas if you take 1.4 and you multiply it by itself 10 times, right, 10 different generations, it's 14. And so you can appreciate how much faster this grows. 3, we don't have vaccinations for coronavirus. We do have vaccinations for the flu. 4, we don't have real treatments for coronavirus, aside from remdesivir, which really just reduces time in hospital, not actual mortality, where we do have treatments for the flu. 5, the way that the flu tends to take lives, it doesn't have the same kind of mortality rate that coronavirus does. So this is a higher mortality disease. And then there's the fact that, if you just look at the numbers, coronavirus, if it didn't kill any more people in America today, literally stopped killing people today, it would still be the 7th leading cause of death for 2020, right? And so this is with massive social distancing. Now imagine we had not intervened the way that we did. There were a lot of pretty plausible models that said that we would have seen millions of deaths. And so that comparison is not a good one. And then the last point I'll just say is, like, why are we comparing one really deadly thing to a bunch of other really deadly things? The goal of medicine, the goal of public health is to reduce all the deadly things. So to say that this one is as deadly as these other ones, well, that is kind of a cop-out, and fails to appreciate that actually we as a society have a long way to go in terms of reducing morbidity and mortality for a lot of diseases. And so I worry that we're getting our signals crossed. And the last point I'll say is this: a lot of folks make that argument to argue that we should not have done the social distancing because they argue that it would have been better for the economy. Here's the challenge, though. We may very well open up and see that economic activity is still slow to come back. Why? Because if you think that you're going to potentially get a very seriously deadly and infectious virus simply by going out and eating at a restaurant or shopping at a retail center, you're not going to go out. And so this argument that somehow it was the lockdown rather than coronavirus itself that hurt our economy, just seems to fail to appreciate what the contrapositive would look like. If we have literally millions of deaths happening all around us in a matter of months, which could have been the case, it's not like people would have just been okay out eating at restaurants and shopping at the mall. We would have seen a de facto lockdown, but that would have been far less effective because it was not coordinated.
Thank you. Dr. Syed, Dr. Fadul, Dr. Madad, who would like to go next?
Sure. So I'll just say a few words about, the heat and transmission and things like that, specifically speaking about different regions, and I'll talk about treatment modalities right now. But basically, I agree with what Dr. El-Sayed was saying. We do know that, open spaces makes the virus less transmissible. So, as we're getting into the warmer months, we do say that it's safer, it's less dangerous than to be in confined, closed spaces where the virus can be transmitted, much more easily. But I think when you look globally, there's a lot of countries that still are, underreporting cases. There's the testing is not at the level where it needs to be, and unfortunately, there's a lot of stigma socially and culturally to promote better testing and better healthcare. First of all, most people in these other countries don't have access to healthcare the way that we do in the United States. You're talking about people who are in lower socioeconomic status and who are have middle class or poverty stricken, who don't have access to even clean water or let alone healthcare. So they may not be getting tested. So we already know that there's a stark underrepresentation of cases that are actually happening in those countries. And then there's so many other variables to this, with socially and culturally, there's so much stigma with coronavirus and COVID-19 in different countries, where people don't want to get that diagnosis, where they're not seeking medical care, where healthcare workers are being completely ostracized and being attacked for taking care of patients with coronavirus. So there's lots of different factors that are contributing to those numbers being lower than what they actually are. I mean, we know for a fact that we have underreporting of cases in the United States, and we're a developed country. So just imagine, globally, how those numbers are really still misrepresentation of what we have out there. Now, speaking about treatments, I'll just say that I had mentioned before that there's really, at this point, there currently still is no FDA-approved treatment that's been proven to be curative of SARS-CoV-2 and COVID-19. There's a lot of medications, that have been available. Are essentially what's happening is repurposing of drugs. So drugs that were used for different illnesses and different conditions are being used, in trials as anecdotal way to see if this has any effect on coronavirus. And the best way, the safest way to really do that, to have the scientific data backing it to show is there any benefit, is to do it in a clinical trial. So the large study that was done with the National Institute of Allergy and Infectious Diseases and internationally as well was looking at that antiviral medication called remdesivir to show if it had any benefit. And recently the data was released from there, which did show that it did decrease the duration of illness from 15 to 11 days, and it did decrease the mortality as well, but that was not statistically significant. So what does this mean? It's a very small glimmer of hope. Although the duration of illness was decreased, it's still very small. It still does not prove that it's a cure for the illness, but what it does is it gives us, a standard, it gives us a starting point. So, from this is going to be now the standard of care for all other trials, all other medications to meet this level. And then this is where drug development starts from. Again, it's not something that we have right now, but it's something to work off of. So when you're dealing with a novel virus where you have essentially no therapeutic right now that's curative, the focus is obviously on vaccination as a preventative measure, but this is a starting point for a therapeutic, and this is what other therapies will be based off of. And the second part of the trial is now looking at addition of other medications, rheumatologic agents, to see if, the combination of different medications will have more benefit than just single agent alone.
Thank you. Dr. Fadul, what can you add in terms of your perspective on these questions, or any other thoughts that you think are important for our audience to hear?
Yeah, so that's, I would like to also go back to the animal question that was posed. So we do know that animals can get coronavirus. That was, I think we all remember the case of the tiger in the New York Zoo that tested positive after having respiratory symptoms. But to this date, we don't really think animals are a major source of transmission. Most of the transmission is coming from human to human, and that's where really the prevention money should be spent and the effort should be spent I would definitely, recommend to be watchful for your animals at home. If they start developing any worrisome symptoms, to check with your vet. But I wouldn't really do anything specific or special to prevent transmission from animals at this point, because we don't really think it's a major source. No, that might change a year from now. We might find differently, but at this point, we don't really think that's a major source. And I'll also just add a comment to Uzma's point about the variables that can go into mortality. There are so many variables why a mortality of the disease could be different from one country to another. One of these important variables is actually the age of the population. In Italy, we've seen very high mortality relatively because the population there is of a higher age, and that's different than some of the countries that we all come from or lived in before, because mortality there could be lower because population that's impacted is much healthier and much lower in age, in addition to the lack of testing and lack of access to care and the stigma and all of the issues that Dr. Syed had talked about. So we have to take these numbers very carefully and very cautiously, because there are so many other factors that actually goes into that number.
Thank you. Dr. Madad, your thoughts about these questions or any other considerations that you think our audience should hear?
I see another question that came through the chat in terms of, the second peak. And I think all the panelists have done an amazing job, answering all the questions. And I think they also touched on the, the fact of when we talk about the second peak, we're in a place where we can prevent a number of new infections from occurring. Obviously, the virus is still out there. It's still infecting people. And unfortunately, we want to make sure people don't put their guards down. We unfortunately live in a society where we look at instant gratification. We're so done with social distancing. We want to go back to normal. Unfortunately, that's not how infectious diseases work. There is no timeline. It's the virus that dictates the timeline, if you will. And so it's important to continue to follow these public health measures. So even though you're seeing a decline in overall cases in some states, we're still seeing thousands of new infections every single day. And as the winter and fall begin, you're going to continue to see an uptake in cases. That's going to be unfortunately inevitable, but there are things we can do to make sure that we keep the virus in check. And so it's important that people understand that, our behavior ultimately can affect the trajectory of the outbreak. So we want you to continue to, wear face masks, even if it's hot outside. And obviously, certainly, as we continue on with COVID-19 in the backdrop, to continue to wash your hands, keeping that 6 feet of distance and so on and so forth. So these everyday public health measures, really tried and true public health measures, are going a long way. And we want to make sure people understand not to let down their guard, because this is something that we're in for the long run. And so when we talk about that second peak, we want to continue to make sure we have some of these, infrastructures at the public health and healthcare delivery level in place to be able to prevent these secondary infections and just new infections in general.
Wonderful. Unfortunately, we have a longer list of questions, but we are out of time. So I apologize to those of you who didn't have your questions answered by this powerhouse group of panelists. I mean, more talent in one place and expertise on COVID-19 and public health than I've seen assembled in a long time. I do want to thank each one of you on our panel for spending the time. I know you're all very busy and in a lot of demand, so thank you so much for joining us. I also want to thank everybody in the audience that spent the time with us live, and those of you who are watching the recording later on, and those of you that submitted questions online. Finally, I want to thank our partner organizations from the National Muslim Task Force on COVID-19, the Islamic Society of North America, and American Muslim Health Professionals, together with IMANA and everybody else on the task force who helped put this program together. If you would like to get more information about COVID-19 from sources that you trust, and more information about the deliverables from the National Muslim Task Force, please do go to any of the websites of the partner organizations, ISNA or AMHP, or to imana.org, that's imana.org, and navigate to the COVID-19 page, where you'll find a listing of a lot of different sources, as well as links to all the webinars that we have. Thank you all so much for spending time with us. Assalamu alaikum.